Hello, my name is Lucy Parker. I'm from Dorset Birth Recovery, and I'm going to be talking to you today a bit about birth trauma, the symptoms that people experience, and the treatment available. So, to start off with, around a third of people consider the birth of their baby to have been traumatic. It is predominantly mothers that experience this trauma, but it is also known that fathers, birth partners, and even healthcare professionals can experience birth trauma. There isn't one specific type of birth that causes birth trauma. There are lots of different births out there. There are vaginal births, caesarean births, births with interventions, inductions, forceps, episiotomies, epidurals, all sorts of things. There isn't one specific cause of birth trauma. It's often a combination of things and how the person itself perceives the situation and how they're left feeling. So, some of the symptoms that people may experience following birth trauma include re-experiencing symptoms such as flashbacks, intrusive thoughts, reoccurring dreams, nightmares, reliving the event, psychological or physical distress and physical symptoms, as well as things like panic attacks. There are also avoidance symptoms such as pushing away thoughts or not wanting to talk about the birth, avoiding places or people that remind you of the birth, loss of memory around parts of the experience, and also feeling detached or numb towards others or the birth experience. And many parents who've been through this often report difficulty bonding with their baby. Other symptoms include increased arousal, which are things like hypervigilance, feeling really jumpy, irritable, angry, difficulty concentrating on tasks, and also difficulty at night, particularly falling asleep and staying asleep. So if you find yourself relating to some of these symptoms, you may be asking, how do I get treatment? I think the most important thing to keep in mind is you do not have to have a diagnosis to seek treatment. You can go and see your GP and ask for a diagnosis, and there are treatments available on the NHS. But if that's not a route for you and you want to seek private treatment, you do not need an official diagnosis. If you feel this is something that you are experiencing and you would like help, get in touch. So what is the birth rewind technique process that I offer? As a qualified and trained counsellor of 6 years now, I've seen various different techniques available. But having now experienced this practice myself and having practiced it on others, I've seen really positive results in 3 sessions, which is just incredible. So this is why I've chosen to specialise in the 3-step rewind technique. So what happens? In session 1, we get together. If you're based locally to me in Bournemouth, we meet face to face. If not, I meet with clients via video phone worldwide. In the first session, we will go through the symptoms that you're experiencing, and if you would like to and feel able to, we can talk about your birth experience. But it's important to remember this isn't crucial, because for a lot of people it just isn't possible for them to talk about their experience. So we will focus on the effects that it's had on you and the symptoms that you're experiencing. We will then go on to look at how you would like to feel if you weren't experiencing these symptoms. We then have a practice session of the deep relaxation technique, because for many people this isn't something that they've experienced before. So we spend about 10 to 15 minutes going through a deep relaxation meditation, and afterwards you are given a voice recording of this to take home so that you can practice between session 1 and 2. When you come back for session 2, we will just have a quick recap of where we're at and where we're focusing to get to, and we will go through the 3-step rewind process. The 3-step rewind process is a disassociation technique that allows you to recall your birth experience without feeling the negative symptoms or emotions that you have attached to it. This is a process, as I said, that's done under deep relaxation to avoid re-traumatizing. After this session, we will have a quick review and see where you're at, and then we will arrange session three, which is normally a week to 10 days after. In session 3, we will have a review of how you felt over the past sort of 7 to 10 days, if you're still experiencing any of the symptoms, and how your life has changed. We will then go into a third deep relaxation process where we will really reinforce those positive feelings and give you the tools to take away if you are re-triggered or experience other challenges in life. I like to take an holistic approach to this therapy and often integrate some of my counselling and coaching skills with this, because as we all know, even when we overcome one challenge, there are other challenges that come up, particularly when we are parents. And I really work with people to give them the tools to take away so that they can overcome future challenges. If you would like more information on the birth trauma recovery service, you are welcome to get in touch. You can either email me, send me a message through my Facebook page, or call me and we can arrange a quick telephone consultation where we can just go over a few details and make sure that the treatment's suitable for you. So I look forward to hearing from you. Thank you.